At times we have to consider in crowding situations extracting permanent teeth, and sometimes these teeth are healthy teeth, and that can be very discerning. But when it comes to crowding, the orthodontist has three things that he can typically do in the permanent dentition, and typically that is extractions versus expansion versus what we call IPR today. In the 1990s, more orthodontists started incorporating IPR into their practice, which basically means you're going in between a patient's teeth and creating room that you might need to unravel that crowding. And in our diagnosis and treatment planning, we're trying to determine how much crowding we have and which one of these ways is going to be best to unravel the crowding and at the same time be most stable. So we're always looking for stability of the end result when we're considering whether or not we want to treat a case with extractions or non-extractions. In our practices, the majority of cases that we treat today are treated non-extraction without taking out teeth. And I'm not talking about deciduous teeth, baby teeth. Sometimes they have to be eliminated. But because we have such a large early treatment practice, a lot of the kids were managing their crowding situations at younger ages to avoid extractions. And we believe that's very important. But a majority of the cases we treat today should be treated without taking teeth out, but sometimes it's necessary depending on how much crowding we have, what the relationships between the upper and lower teeth look like, and sometimes it's what you have to do, and you can still reach nice dental and skeletal relations. My father did my orthodontics, and I had 4 premolars taken out, and I'm keeping my teeth, take care of them, I have a nice result, and it worked out well for me. And in those cases where you do have to have extractions, it works out well a majority of the time. But again, most cases that we treat today are treated without taking out permanent teeth. Again, an important part of making sure we see patients when they're younger and we can start to do the things we need to do to avoid extractions.